be spending lots of time in your kitchen preparing food for guests at your Super Bowl party, while doctors are preparing for a blitz of heart attacks. Joining me now to talk about the spike in heart attacks on Super Bowl Sundays and how you can protect yourself is cardiologist Dr. Asif Ali. He's with the Ibn Sina Foundation Clinics. Good morning to you, doctor.
Good morning.
Thanks for coming in. So there have been actual studies done that show the Super Bowl can, in fact, be linked to an increase in heart attacks. If your team loses after the game, why is that?
Yeah, sure. So you've heard of that adrenaline surge, that rush that you feel in your chest, that fight or fight response. So when we watch the Super Bowl, hey, it's exciting time. We're rooting for our teams. We want them to win. And when they're losing, guess what? That adrenaline surge increases. That increase of adrenaline can increase your blood pressure, your heart rate, and in someone who's predisposed to heart disease, that can be the tipping factor where they actually can have a heart attack.
That's what I was just going to bring up, is that when you've got that combination of emotional stress plus the risk factors, it can be very dangerous. So what are some of the risk factors? Who would be more at risk on Super Bowl Sunday?
Sure. So these are chronic diseases that we see time to time. Hypertension, diabetes, smoker, if you have high cholesterol, or lack of exercise. So these kind of predispose you to having blockages in your artery, also known as coronary artery disease.
Okay.
And in fact, in a study done in Journal of Cardiology, they actually found when in 1980, when the LA Rams played the Pittsburgh Steelers and they lost, for the next 2 weeks, there was an increase in heart attacks. But in 1984, when they did the same thing, and the Rams won, actually, the heart disease and heart attacks were decreased. So they linked it to this adrenaline.
It's a very interesting link for sure. And other sports I know have been linked to it in the past as well. Now, we all know a lot of food is eaten on Super Bowl Sunday. What seems to be the bigger precipitator of heart attacks? Is it that emotional stress, or is it the food choices?
So that's a great question. So actually, the emotional stresses were found in the Journal of Cardiology to actually, that adrenaline surge in those patients who were over 65 with predisposed heart disease were the ones that were the most susceptible. However, we know Super Bowl Sunday is full of salt and sugar, and so for those patients who have maybe heart failure or high blood pressure, we may see spikes in those patients, and they may end up coming actually to the hospital for heart failure treatment.
There's also been a recent study done showing that sugar is a bigger problem than salt when it comes to heart problems. Do you have an opinion on that? And would you say that sugar is the bigger culprit?
So sure, there are studies that have come out that actually sugar too can increase blood pressure as well. And of course, spikes in our diabetes. So there's a combination of salt and sugar, and we get a lot of that during Super Bowl Sunday.
If someone does have heart issues in their family, what kind of precautions should they take?
Sure. So if you're watching Super Bowl Sunday and you already have a family history, you start getting chest pain, short of breath, and in women, you can get jaw pain, shoulder pain, and it doesn't go away, you may want to go ahead and seek help.
Yeah. If you feel yourself getting worked up, just step out of the room maybe too, right?
That's absolutely right.
Okay. Well, Dr. Ali, thank you so much for coming in. We really appreciate this helpful advice, and we hope that everyone has a calm, cool, and collected Super Bowl Sunday.
Thank you so much.
Thanks.